The state has a quality strategy, a public health strategy, a Medicaid strategy. None of them are combined. They're all different things. They're all disparate things. And then the Medicaid plans incentivize the health plans with HEDIS measures that don't match up against what their state quality strategy. It's just whether or not, they're meeting the 75th percentile of them. So now you have the agency, the public health, the payers all have different initiatives. And now the providers are like, listen, we're really interested in doing these things. So I'm going to give you an example. Like, I remember when I was running a payer organization, like we were able to hit most of our HEDIS measures, but like lead testing was really hard. Well, you go to a hospital and be like, I don't care about lead testing. Like, that's not even on my top 20 list. Like, I want to figure out how I can get my frequent flyers out of my ED. I want to figure out how I can raise, and do better disease management. I want to figure out how I can do other, episodic type things like total knee replacement, like in an outpatient basis. They're looking at that. I want to reduce sepsis. And here I am like, well, we'll give you money if you can do some more lead testing. It's like, looking at me like you're not even speaking. And that's the problem. Like if I go back and be Medicaid director again, like just for a few years, like when I would develop these things, I would develop it as an entire ecosystem. So we're all incentivized to do the same thing. Cause that's when the magic can really happen. Like that's when you can really like move the needle on things. And we're seeing that now around maternity outcomes and justice involved individuals and foster care kids. Like finally we're all like, yeah, that's all important to all of us. So now we can try to move the needle on that. But there are so many different aspects in these small ecosystems that just financial incentives don't align. And if they don't align, then the investments aren't going to align.
Yeah, it's interesting. I've done some consulting work for like Francisco Partners and Carlyle Group, some of these really big ones. The issue that I see, and the good guys, but their purposes are a little different. They're not actually trying to invest in the future. A lot of them say they are, but they're really looking for this shorter term hit, which is weird. Like VCs are short term, right? Invest, we're trying to get people to the B round, C round. Someone else gets in, we mitigate our risk. There's going to be a acquisition, or they're going to go public or something. Most likely an acquisition. Private equity is like we're trying to buy revenue streams and cut costs and all this kind of stuff. But it's what the toughest part for me had been in the past. You might see the same thing where they're really good at looking at spreadsheets. They look really good at doing financial modeling, but because they're so ignorant about the domain of where a company or an organization exists, that you say things that they can't actually, doesn't even make it into their head. It's almost like it's completely ignored. You're like, okay, I know I can tell you've ignored that. That's going to color everything now. Like you can't ignore that. We have to get back to the context of what you're talking about. Like you think this is important. This technology company looks great, et cetera. Have you seen these other factors that are out there right now that are going to be a block? It's going to make it harder for them to actually get adoption or grow. And then also, here's where other things are going. Other companies are going. Here's kind of the consumer behaviors that might impact it. And it's almost just like, because they don't understand what I just said, and I don't know how to bring it to their level of knowledge all the time. They usually just go and it's okay. All right, let me know about your next project. But being you've cracked this code. Being just this advisor they can keep coming to. That's where it's probably my personality. Maybe I'm just not nice enough. I'm probably not. I was watching this. Actually, yeah. I was watching this show. Have you seen Ford versus Ferrari? I'm more like the Ken Miles guy, the driver who just can't, doesn't matter if he's talking to the chairman of Ford. He's just going to, like the filter isn't there. But I need to be more, I think, patient with investors. And I'm just not. We get to a certain point, like, hey, you're paying me because supposedly I'm an expert, but you're not listening. I'm not telling you not to invest. So I'm not telling you, here's how you should value the multiple. Here's what your liquidation preference should be. I'm not advising you on any of that. Like, that's your world. But I do know this world. And if you're just going to discount what I say, like, I don't know why you're spending it. And maybe they're just so used to working like the McKinseys of the world, which is just going to tell them whatever they want. We'll charge you 10x what John charges, but they're going to give a prettier PowerPoint and they're just going to say exactly what you want to hear, just in a different language.